Diabetes and high blood pressure can silently damage your eyesight, leading to vision loss and even blindness without you even realizing it. If you have diabetes or hypertension, this video is for you. Today, I'll explain how these conditions affect your eyes, the warning signs you should never ignore, and what you can do to protect your vision. And if you haven't already, be sure to check out my YouTube interview with Dr. Al-Anan about diabetes. It's packed with valuable insights you don't want to miss. Now let's dive in. How does diabetes and high blood pressure affect your eyes? Our eyes have a rich network of tiny blood vessels that supply oxygen and nutrients to keep them healthy. However, when blood sugar levels are constantly high or your blood pressure is uncontrolled, these delicate vessels can suffer some damage. High blood sugar can cause temporary swelling of the lens inside your eye, leading to blurry vision. This is why some of my patients notice that their glasses don't seem to work properly when their sugar levels are too high. However, once blood sugar stabilizes, vision often returns to normal, but these patients are left with multiple pairs of glasses. Over time, uncontrolled diabetes can cause small, balloon-like bulges in the blood vessels of the retina called microaneurysms. These can leak blood or fluid, leading to distorted or blurry vision. High blood pressure can cause blockages in these tiny blood vessels, leading to sudden vision loss, which is called a retinal vein occlusion or branch retinal vein occlusion. So what are the stages of diabetic retinopathy? It obviously has levels in terms of severity. The first one is non-proliferative diabetic retinopathy, where we don't see any new blood vessels. However, all we see in the back of the retina is small hemorrhages and microaneurysms appearing in the retina. There are two main stages of diabetic retinopathy: non-proliferative diabetic retinopathy and proliferative diabetic retinopathy. Let me explain the main difference between the two. The proliferative develops the new baby blood vessels. Blood vessels start to leak, causing swelling known as diabetic macular edema, which means swelling in the back of the eye. Symptoms may be mild or non-existent, which is why regular eye exams are critical. Proliferative diabetic retinopathy is the more advanced stage of diabetic retinopathy. That's when body tries to compensate for damaged blood vessels by growing new, fragile baby blood vessels. This process is called neovascularization. These new vessels can rupture, causing vitreous hemorrhage, which lead to sudden vision loss. If untreated, scar tissue forms, pulling the retina away from the back of the eye, leading to retinal detachment and permanent blindness. How do we diagnose and grade is diabetic retinopathy? The first stage is the mild, non-proliferative diabetic retinopathy, where we only see small microaneurysms. Then more extensive bleeding starts in moderate to severe diabetic retinopathy. In proliferative diabetic retinopathy, which is more of an advanced stage, we actually start to see those baby blood vessels, networks of blood vessels, and bleeding in the retina, leading to retinal detachments and complete vision loss. 1 in 5 people with diabetes tend to develop diabetic retinopathy, which is why in our office we use advanced imaging technology like fundus photography and OCT scans with angioplex to detect and grade diabetic retinopathy as early as possible. Here's what we look for in those photos and advanced OCT angioplex imaging. If we detect moderate or severe bleeding in the back of the eye or any signs of those baby blood vessels forming, we start the co-management with a retina specialist for advanced treatments like anti-VEGF injections, laser therapy, or even surgery. 1 in 10 people with high blood pressure experience hypertensive retinopathy, and 90% of vision loss due to diabetes is preventable with early detection and treatment. The best way to prevent vision loss is through yearly dilated eye exams, even if your vision seems fine. Strict blood sugar control, keeping your A1C below 7%, managing blood pressure and cholesterol is important to prevent retina damage. If you found this information helpful, please like and subscribe to my channel. And don't forget to check out my in-depth discussion with Al-Anan about diabetes. It's a must-watch.